Good morning. We are very excited this morning to introduce this discussion with the Senator of Florida, Senator Audrey Gibson, hailing from Florida's District 6, which includes sections of downtown Jacksonville and Duval County. Senator Gibson she's out here making history. She's introduced and passed a bill, the new Fibroid Research and Education Bill in Florida, it's amazing that this bill has gotten passed. It's been something that people who advocate for fibroid awareness are truly inspired by, truly excited about. And we're going to talk with Senator Gibson today about the passing of that bill and how she did it. That's what we're really interested in, because we want that to be something that's widespread for years to come. Senator Gibson has also introduced and co-introduced bills supporting child care, healthcare, elder care, anti-discrimination, and many others. She served as the Senate Minority Leader for 2 years and currently serves on multiple committees. Prior to that, she served in the House of Representatives for 8 years before she took the Senate office in 2011. So welcome, Senator Gibson. Thank you for joining us in this conversation.
Thank you.
Recently, Senator Gibson, the companion bill for uterine fibroid research and education was signed by Governor Ron DeSantis, which will take effect July 1st, 2022. July is Fibroid Awareness Month, so how fitting that it will take effect in that month. And this bill will require the Department of Health to develop and maintain an electronic database of information related to uterine fibroids and require healthcare providers to submit certain information to the department for inclusion in the database. This is huge and this is remarkable. So let's just first talk about the bill itself and the importance of this bill and what it means to you to get this bill passed.
Well, and thank you again for having me. And I first want to start by thanking my House partner, Representative Anika Omfroy, who asked me to sponsor the Senate bill. And I said, absolutely, I would do that, because obviously you have to have a House and Senate sponsor for the bill to make it to the floor, get passed, and then sent to the governor's office. And so at first, as the daughter of a healthcare professional, my focus in my entire career in the legislature has certainly largely included healthcare issues and healthcare disparities. And so usually on the floor, I tell personal stories, because I always say what's happening in my family, I know it's happening, it's multiplied across this, in my district, across the state, and really across the country. And so my personal story, and even Representative Omfroy doesn't know that I had fibroid surgery years ago. And so when I began to read the data, I'm very data driven. When she asked me about the bill, the first thing I wanted to do was make sure I pulled up the data, because that sometimes, most times, not always, helps people to make decisions. And we are in a Republican-led legislature. I've been in the minority and super minority my entire career in the legislature, and sometimes it's difficult to convince individuals to support something. And so the data showed not only in Florida, but across this country, that millions of women, generally childbearing age and a little beyond, suffer with fibroids, and surgery has always been the option. And we wanted to look at something different than just a surgical procedure. Because it is major surgery. And so I was happy to sponsor the Senate bill.
And thank you so much for sharing that personal note of you having a difficult time with fibroids as well. When you were a fibroid patient, if I may ask, what was your takeaway from the experience that you had dealing with fibroids when you did?
Well, first of all, I suffered severely with anemia, to the point where I was having like burning in my chest, and I couldn't really figure out what was happening. And that's when the physician noticed that I had the fibroids, and it's a very painful surgery, and it takes quite a number of weeks in your life to recover from that surgery. And so, can you repeat the second part of your question one more time? I'm sorry. I want to make sure I answer it.
Absolutely. You are actually answering it. I was just
Okay.
asking you about your experience as an actual fibroid patient, what your takeaway was as a fibroid patient from that experience. And you're actually answering that question right now, especially talking about the invasive treatment that you received, which, I can relate as well. I've had 2 of those invasive treatments, both who landed me in the hospital for extra time beyond an intensive care unit. So I can definitely relate to what you're saying, Senator. And, thank you so much for sharing that. I'd also like to introduce Dr. Yonke Nelson, who is the CEO. He's the founder of USA Clinic Group, specifically for USA Fibroid Centers. And he's pretty much disrupted the fibroid treatment platform in America with offering women over and over again, offering women the non-invasive treatment of uterine fibroid embolization, which is something that's not typically offered in the doctor's offices still to this day, even though we've had that treatment around since the mid-90s. So Dr. Yonke, first of all, welcome to the conversation.
Thank you for inviting me.
And also hearing Senator Gibson talk about this fibroid bill passed in Florida, what does that mean to you as a healthcare provider?
It means a lot. It's actually means that miracle can happen, because we've been working with the U.S. Senate and Congress trying to push the bill, similar bill that was around for about 15 years in the making, but still didn't pass. Despite overwhelming evidence how much fibroid disease, the most common disease women suffer, ruins a woman's life, from physically, mentally, emotionally, socially, and it's a source of pain, suffering, that impossible to even compare how much it takes away the quality of life and best 20, 30 years of life, and everyone ignores. And having finally, someone in the government said that should stop is incredibly important, and would like to learn, Senator Gibson, from your experience, how you made it happen, and also learn what can we do as a healthcare providers to make this bill more successful. What data you looking to gather, whether you have enough data to support uterine fibroid embolization as basically the only fertility enabled minimally invasive treatment that can be done in the office, 30-minute procedure. And why is that? How can we make sure that when we have a minimal invasive procedure, why do we need castrate women on a daily basis? And about 500,000 have a removed uterus castration every year for benign a problem.
Senator, I'm not sure if you could hear Dr. Katsnelson, but he's, basically asking how you managed to get the bill passed. We know this has been a very much a. Can you hear us okay, Senator?
Yes, I lost the doctor on my screen, but can you see me?
Yes, we can. We can.
If you'd like, I can repeat the question.
Would you kindly?
Thank you very much. First of all, Senator Gibson, congratulations. The passing the bill is a miracle to me, because we've been working with the U.S. Congress and Senate on similar bill that was around for 15 years and never passed. But you managed to do that. Second thing, I would like to learn how in the framework of your bill we can help women by gathering more data. What specific data you're looking for, and what data, additional data is needed to prove that minimal invasive treatment that enables pregnancy and very happy life, like uterine fibroid embolization that can be done in the office, 30, 40-minute procedure, still need to have extra proof to tell that it's better than hysterectomy, that basically castration for benign procedure, because we have plenty of data and can be very efficient to help your bill and to help Florida and other women nationwide.
Oh, that's a complex question.
I think translating
you pulled out very complex bill, so I think that's what we need to do.
The first question, in getting the bill passed, of course, it was assigned multiple committees in the House and the Senate, and so it's just a matter of going to those chairs and saying, we really need this bill. It is really urgent in our communities, and particularly impacts women of color, particularly African American women, and the sentiment, I believe, of late with the speaker more, is that we should focus on at least some health disparities as we move forward in our legislative work, and potentially, and we were flushed with federal dollars as well, so there is no reason not to pass legislation that helps to reduce health disparities, and also helps to look at safer and less invasive treatment for women who suffer from fibroids. And then I also work the House side, so and go over there and say, listen, I need you to bring this bill up in the committee, because it was a tad bit stuck, and there is no reason for it to be stuck in either chamber. In terms of, you mentioned the data, I think the data is already there. The numbers of women across this country and in this state, and therefore if it's across the country, it's in every state, and Congress should understand that. The data is already there, and so are, as you mentioned, alternative treatment as opposed to invasive surgery. And so one of the things I think we may need to look at is who knows about, what physicians know about the advancements. And part of that information is collected as part of the bill to collect the data, right? Sometimes also, I think we need to determine who are the Medicaid patients as well, because sometimes Medicaid won't allow a physician to choose a different method of treatment. And that in itself creates disparities too. And so that is an issue. I'm not sure if that's a congressional issue, but it's something that we also have to make sure we're including. What are the Medicaid patients who develop fibroids and need treatment, and not necessarily surgical treatment.
Wow, that is so. So you're saying that Medicaid, this is news to me, I'm sure it's news to others, but Medicaid won't allow any other treatment other than a hysterectomy for women with fibroids?
I'm not sure. That's
Okay.
why I'm saying we need to determine that.
Okay.
Because that's a population of women that need to be included in alternative methods. And so as we collect the data, we should make sure that we're collecting healthcare, what kind of healthcare coverage all women, I mean, the women have who are suffering from the condition, right? That's an important element, because healthcare coverage is essential. And if you don't have it, then you're suffering. And if you can be at a certain income level, you can qualify to have your medical services delivered through Medicaid.
So, Senator, I just ask our clinical specialist to confirm whether UFE is covered by Medicaid of Florida specifically. Hopefully, we'll get the answer in a couple of minutes.
Mm-hmm.
It usually is covered. It's covered in New York. It's basically covered by all states. I'm aware that in Illinois, it's not covered in the office, but pretty much I'm sure that all states cover fibroid embolization. I think the two important points you mentioned that's critical. Doctors don't know, but in reality, I think they pretend they don't know. But because if you go to gynecologists, they feel, I think, God-given right to be in charge of certain part of the body. And that's what they do. They have a toolkit that they usually do. It's written in all gynecology textbooks. You have myomectomy, hysterectomy, those things. In their books, they don't have a mentioning of uterine fibroid embolization because it's done by different specialty. And sometimes this miscommunication create the opportunity, not necessarily mislead, misinform, but not completely inform patients about different options. Kind of missing when you say there are two options available for you, myomectomy and hysterectomy, maybe a couple of words will be omitted from the sentence, like in my hands, you have this and these options. But in general, other options exist, like I'm a heart surgeon by training. In a heart surgery, many conditions done by cardiologists through percutaneous procedures. So I think everyone knows, but because there was no kind of accountability, data-driven confirmation that everyone knows, people pretend that they don't. And I know that government can ask through the agency, like licensing agency, to have a one course, like 1 hour course before renewal of licenses that for like a drug addiction or diversity awareness or different courses that we all take before renewal of licenses. And maybe there will be a course before licenses renewal to make sure that every person who has a license after a certain date, they pass the course and they cannot say that they don't know. Is that something, Senator Gibson, was kind of one of your ideas, how to make sure that doctors are educated?
Yes, that's the purpose of having the database and collecting the data so that it's available for all physicians or nurse practitioners for all to see, and that way the information spreads, or it has the potential of spreading more than one by one. And collectively, everyone can see it, because the bill also requires that any health pamphlets that are produced by our Department of Health, and particularly any that is developed and distributed to women, include the information and alternative treatment for fibroids.
So, Senator Gibson, just another
I'm
question.
not a doctor or a nurse, but
No, but you've made more. You're helping more women than thousands of doctors by doing this bill. And I'm just trying, because I'm a doctor, I know inner workings for certain things, and I'm trying to understand whether this bill can accomplish through very small, inexpensive things. So that one of them, for example, we can ask Department of Health to modify guidelines, at least maybe not for Blue Cross Blue Shield, but for Medicaid patients, to make sure that before they get authorization for hysterectomy, they need to explain why minimal invasive options are excluded and not good for this particular patient. I don't like when you say when we say other alternative. When you have a final, the biggest, the worst surgery, literally castration for benign condition, why other things that minimal invasive alternative? That needs to be a gold standard. That will be first to go thing, not maybe consider alternative. No, you need to consider hysterectomy as the last resort. And in general, for fibroid treatments, that medications, they're not fertility friendly because they basically put women to menopause, like Lutron. And you don't want 25 years old girls in menopause, not about whether they want to be pregnant or not. It's like the whole other thing. And you don't want myomectomies. And you also don't want people left suffering from, anemia, from pain, from 2 weeks menstrual period. Number one reasons for spontaneous abortions, infertility, the whole cost, I believe, in hundreds of thousands of dollars, healthcare cost of taking care of fibroid disease over 20, 30 years. Cost of uterine fibroid embolization, let's say $10,000. You have a 20 to 1, 30 to 1 return on investment by early intervention and fixing the problem very early, so people will have a wonderful, the best version of their lives. And I was wondering, in this bill, can we go and make sure that every doctor by renewing licenses, for example, one of the examples, in database that they informed, they cannot say, oh, I'm not informed. And B, and basically, if they will not recommend and they inform, I don't know, it's travesty. It's very bad. I mean, it's unethical. It's terrible. And two, just the medical guidelines can be changed and said that before chopping, please tell us why can a woman get something minimal invasive. So what do you think about the guidelines? Is it difficult to push healthcare to make this thing? They have so many guidelines. I think they can put the right one too.
Well, it won't happen in this particular, which it's not a bill anymore, it's law. And so, or it will become effective in July. And we're done in session. But the points that you raised certainly are important. And I think, though, I just want to make sure that you're speaking about making sure that the woman knows that there's a choice too. So that I want to make sure that that is not lost in this discussion, but that doctors should make sure that they offer something else, and then talk about the differences, that they offer other treatment that is not detrimental, obviously, as you talked about, to young women who also develop fibroids as well in their childbearing years. So we just want to make sure, I think you're leaning towards making sure that women are given the choices: surgery with an explanation, or a different treatment with an explanation. Because I'm sure there would be timelines. I don't know the procedure totally with a non-invasive treatment, but all those things should be taken into consideration with the patient and their doctor. That's number one. But requiring doctors to offer the choices, I'm not sure about how that part would work. As a part of licensing, I'm not sure how that part would work. I'd have to think about what that kind of legislation looks like.
But
the other part of it, I'm sorry. So the other part of it then goes back to the distribution of information or pamphlets of this Department of Health information that we're asking the language from this bill to be included on. It has to get out to the women and their families, so they know to ask the question if the doctor doesn't bring it up.
Right. And I think with Senator Gibson, what the law is seemingly to exude now is more of a macro look at fibroids, and looking at, specifically how often women should get a checkup with their doctors to prevent fibroids and to stop the disease from getting worse, which is part of what this law entails. So, and I think what Dr. Katsnelson is mentioning is more of looking at us revamping the preventative measures that we can take overall, so that we can make sure that women know that they have the choice. So that really involves kind of like a look at the overall system, right? When we're looking at what's considered preventative care in our healthcare system. So it's important that, we all work together as an ecosystem to really make this happen. And so with that said, I'd like to ask you, Senator Gibson, how important or how likely is this to springboard HR 2007? Is this something that we can look at that can further push that full national bill, the Stephanie Tubbs Jones Uterine Fibroid Research and Education Act of 2021?
Well, I'm not sure why the bill is stuck. So
we don't either, but
and so the first thing you have to figure out is, why is the bill stuck? And maybe that's a question for the Congresswoman. Who is, and that's in any legislation, whether it's national, state, or local, you have to figure out, well, who is against this and why are they against it? Or, that's the first thing. If you know the fours, that's great. But if you have a holdup of a piece of legislation, you want to know why that is. I don't know what's holding up that bill, so I can't really speak to the movement thereof. And so the bill sponsor may be able to help you with that. And certainly, as you mentioned, if such a bill as this could be passed in every state, that may be an impetus for Congress to do something. And then the database also comes with, it's an appropriation. We were happy to receive it to establish the database, and then it has recurring funding to keep the database going, because obviously you have to set it up to whatever the mechanics are of setting up the database, and to be able to receive the information and then distribute it. And so the recurring money helps to make sure that the database continues to function as it should.
Absolutely. I'd like to ask you about any of the numbers in Florida that basically springboarded. I mean, I know you had your own personal experience with uterine fibroids, but also the numbers in Florida justifying the passing of this law. Are you able to speak on those numbers?
I don't have them memorized in my brain. So.
We know there's enough. We'll just say there's enough.
And I don't have that particular chart in front of me, but so I just know my research showed, I don't know, certainly over 1 million. And I believe it was closer to maybe 3-ish.
Oh, wow. Yeah, that's definitely enough. Too many, one too many. And Dr. Yon, you have national clinics across the country treating women with uterine fibroids. As the CEO of USA Claims Group and USA Fibroid Centers, what have you seen on a national level in terms of fibroid health disparities with women?
I see tremendous suffering, pretty much universally. Women get hysterectomy, and we have Medicaid data. More than 42,000 women a year get hysterectomy. This procedure called Mississippi appendectomy. That's how often. And certain doctors, average age is 27 for hysterectomy. It's unbelievable, and that must stop. The suffering, the torture, it must stop. And I think I applaud Senator Gibson that she was able to make such a wonderful difference and create the framework And you're right, Erica. All my questions before, they weren't like a tactical in the spirit of this bill, what the healthcare department can do specifically. But also, I want to tell you that the patient education is a key. That's what we do nationwide. We really don't have many gynecologists asking us to help patients with UFE, but we have thousands of women calling us, and pretty much no one heard about uterine fibroid embolization until they listened to our educational videos or other information over the internet. And that's very much concerning. And I was wondering whether um, Senator Gibson thinks that early detection, very screening with the, let's say, ultrasound is appropriate or someone recommended. We know about colonoscopy, mammography, a few other like blood testing for cholesterol and other things, checking the blood pressure, smoking, so preventive measures. But it's very simple to diagnose fibroid disease with a simple ultrasound, like literally 5-10 minutes, $100, very accessible, non-invasive diagnostic tool that will show whether there's a fibroid or not in 95% plus cases. Sometimes MRI needed, very rarely, but you can pretty much say whether you have it or not. And then early on, just make a determination when it's sufficient enough to treat or not, no need, and people not worried. So whether to educate women and take it to next level, not just women should know about disease and what's, even if it's common, it doesn't make it, healthy or right. But next step, what do you do with this knowledge? Can they go and can, maybe healthcare promote um, uh, transvaginal, transabdominal ultrasound as a tool to diagnose and then make it treatment very much data driven. Then the fibroid is not matter of opinion, it's matter of fact, whether it's there or not.
I'm sorry, Senator, we can't hear you at the moment. I think your sound has gone down.
Yes. So another compound question and statement, because you also have to remember that the bottom line of discovery is going to depend on healthcare coverage. And I have to keep repeating that because that is the critical component. And so in terms of if it's not already included in a healthcare plan to do the ultrasound, you may know, doctor, I don't, then that is a step that has to be discussed and worked out with the insurance company.
It's covered.
And so it's
covered.
I'm sorry?
It's covered. It's covered. That this thing is available, affordable, attainable to all the patients. Ultrasound. They just don't do that. It's like people know that mammography, colonoscopy are covered, but then insurances or Medicare, CMS says, please do it because it's good for you. It prevents further progressive disease and it's better and cheaper for the society and better for your personal health. So there's no invention of something new. It's more like a leaning on a patient education and says, it's good for you. Do that earlier rather than suffering.
Yeah. And I think what he's explaining is that the fact is that it's not routinely offered. The transvaginal ultrasound is not routinely offered. For
transabdominal fibroids.
Yes, it's transvaginal. I'm sorry, transvaginal ultrasound is not routinely offered, and so it would be beneficial for physicians and for even legislators to understand that this is something that women need to know, that it's something that we have to ask for, but it should be something that we shouldn't have to ask for. It's something that should be offered, and doctors should be overall, all of the change agents should be educated about the fact that that's something that should be offered to women, versus an abdominal ultrasound and then the recommendation of a hysterectomy. So we want to make sure that that's that's included in the educational component. When we're talking about educating healthcare officials about uterine fibroids and quantifying the amount of women that suffer from fibroids, that these options are available. Um, these types of exams need to be done on a routine basis. So it goes hand in hand, Senator, with what I believe that you were pushing for with this law. As long as we have the information there to quantify the number of women that are suffering, we can't ignore that number, and we have to take charge um, of what we're offering in the exam rooms, in the operating rooms.
Well, and I agree with you. I don't know what's covered and not what not covered in every single person's medical plan. And so my thing was, if it is covered, then yes, physicians should make sure that their patient knows that is an option. And then we have a duty to make sure that women know that they need to ask if they're not told about such an option. And I believe I heard the figure of what does it have, a copay of $100? Is that what the doctor said?
No, I said it should not have any copay, and it's very inexpensive ultrasound. It's one of the less expensive diagnostic studies. And it's very common piece of equipment that many doctors have. So it's something that's very affordable and accessible. And Senator Gibson, I would be thrilled to provide more information from what's covered, what's possible, just for your or your team or healthcare department consideration, what to include in education, because we in the business of education for 15, 16 years, educating patients about very common condition that actually can be curable. USA Clinics Group, we're not focused on just caring for patients. We focused on the condition that can be fixed, cured, and disappeared. So that's why I think effective patient education is a key, and would love to provide more information to help it more successful.
Okay, and so I'm happy to receive that information in layman's terms. So, and I'm happy to send it, make sure it gets to the Department of Health, because I will read to you the Uterine Fibroid Education Outreach and Public Awareness. The department shall develop and include information related to fibroids in literature on women's health care and other related healthcare, which is currently made available to the public to increase public awareness of uterine fibroids. The information must include, but need not be limited to, possible risk factors for developing uterine fibroids, range of available treatment options that are considered alternatives to hysterectomy. It's in the law. And so I'm happy to receive information that you may have that I can certainly make sure goes to the department in the development, to be included in the development of the literature. I tried to cover all the bases because yes, I do know that public awareness is number one.
Absolutely.
Yes, ma'am. We're very much law-abiding citizen, and we will follow your instructions and provide you all necessary information. But it's amazing how in few sentences that was thoughtfully included to make sure that we have a framework to provide information, what's available, what's possible for education, for treatment, and we'll just make sure that all information is provided. Thank you very much.
And it will be online as well, and we can get certainly the brochure, and they have the brochures, literature that they develop anyway, still use some paper sometime. And so making sure that that information also reaches doctors' offices and certainly distributed in our churches. The law says we have to do it. The dissemination has to include all of us, including wherever they send their information, wherever it's posted. But I'm a believer in, I do e-blasts all the time with information to people in my database. I'm also a believer of taking information to churches, community centers, meetings that I attend. And all we need now is for everybody in the state to have that kind of impetus. That's all.
Absolutely. And just to verify, Senator Gibson, this is something that will be required from doctors in the state of Florida to report this information to the Department of Health.
Yes, the database. Let me go. I'm trying to make sure that I absolutely. So because we named the folks who are in the bill that should be sending the information to the database.
Excellent.
And it's not just it's physicians and other providers who treat women.
Absolutely. That's phenomenal. Before we wrap up the conversation, I did want to ask you if there are any other supporters of this law that you'd like to mention. I think you mentioned someone early on, but is there anyone else who was key in supporting this bill, this law?
Well, I think Representative Onfroy worked with some others previously to try to get, I don't know if they tried to get legislation done, but I do know that they wanted recognition for the occurrence of fibroids, certainly in the health disparities universe. And so I think some of those, I can't find her information that mentions it, of previous legislators who worked on establishing the Fibroids Awareness Day. And I'm sure you'll probably be chatting with her. She may be able to give you those House member names, I believe.
Absolutely. And we know that's also public information, so we'll take a look at that as well and encourage others watching this video to do the same. I'd like to just get some very brief closing thoughts from the two of you on this this precedent that has been set by Senator Gibson. Let's start with you, Dr. Nelson.
I just want to underscore that it's amazing. It shows that with determination and right teamwork, even minority situation can be overcome for the sake of women and patients. And we just need to make sure that we help to scale as we have many locations and speak with the patients and legislators and other things to follow your steps. Second, I want to thank for opportunity to work within the legislation, provide information, and work maybe with health department to operationalize and to the highest potential, your goals. And the third thing, I was wondering, I know you're very busy, but if you can sign up to become a fibroid fighters, we can give you a general or whatever you would like, but you'll be the boss because you can get things done. But if you can sign up to become a fibroid fighter, that would be phenomenal, or a fibroid fighter ambassador.
I'm happy to do that.
That's
okay.
Beautiful.
We have it recorded. Thank you.
And so I did find our press release, and I want to give the shout out. It says that in 2015, a resolution was advanced to designate July as Fibroids Awareness Month. And that was by Representative Hazel Rogers, who I believe is a mayor in a city in South Florida now, and Senator and now Representative Geraldine Thompson, and Representative Onfroy, and Tanika Gray Valburn. Those are the names that are in the press release for the resolution in 2015.
Excellent. Thank you so much. And we're familiar with some of those names on there. So we thank you all for being fibroid fighters in your own right, and for you for joining us in the ranks of the Fibroid Fighters Ambassadors with the Fibroid Fighters Foundation. And so thank you again, Senator Gibson. I hope this feels like an amazing win for you, because for a woman with a history of fibroids like myself who is still in the fight, it is an amazing victory. And we hope that other states will follow suit in what you've accomplished there in Florida. So I just want to thank you both for your time, for your energy and your effort and your expertise in this conversation. We hope the conversation continues, and we hope that it becomes more positive, and that more physicians will have that paradigm shift that we need when it comes to treating fibroid patients. So thank you both. Go back to your corners. Excellent. Do the work that you do. And thank you so much for joining us today on Break the Silence, Break the Behavior.
Thank you.
Thank you. Thank you, Eric. Bye-bye.